It was a partnership among nearly 24 Florida nursing homes and the state. The deal? To take in COVID-positive seniors and will pay you more for it. Nearly 1 year after this state program ended, investigative reporter Katie LaGrone discovers how you paid for Florida's COVID isolation centers.
May 8th, 2020.
This here is a secure location that will exclusively care for medically stable COVID-positive patients who reside at other long-term care facilities.
Florida's governor announces the state's latest tool to combat what at the time was a virus almost exclusively attacking the elderly and vulnerable.
I can't tell you how important this facility is.
Over the next few months, Florida designated 23 nursing homes COVID isolation centers, facilities contracted by the state to house the elderly and COVID positive.
To be able to isolate that cluster so that it doesn't spread throughout the facility. And we think that that's something that's been very, very effective.
A year later, we've also learned it wasn't cheap. According to the state's Agency for Healthcare Administration, Florida taxpayers paid these 23 Florida nursing homes at least $51 million, with roughly half receiving over $1 million in the months-long deal, which ended in October. Dolphin Point, a 146-bed nursing home in Jacksonville, was the state's first COVID isolation center, where Governor DeSantis proudly introduced the program. It was also the state's highest paid, receiving just over $7.8 million in state and federal reimbursements, according to state data.
That's a lot of coin. $7.8 million is a lot of money for a nursing home.
Brian Lee is a senior advocate and former Florida ombudsman. He's also been a critic of the Florida's isolation program from the start.
It almost looks as though that it was really crafted, these isolation centers, to incentivize, or at least to be a financial incentive to subsidize and help these nursing homes financially.
State contracts reveal in addition to normal Medicaid reimbursement fees, these COVID isolation centers got paid extra, $325 extra per COVID patient per day. Empty beds, no exception.
Paying for non-services in a facility, that's pretty shocking.
And we've learned some were paid even after the last COVID patient left. At Dolphin Point, its state contract shows the facility was reimbursed its normal Medicaid rate for 4 months after the last COVID patient was discharged in October. Though the contract was for 146 beds, there were very few months the state paid to reserve all 146 beds. The owner of its management company told us in this email. He declined a video interview but added the facility's $7.8 million in reported COVID isolation payments sounds possible given the time frame and duration. He explained the extra payments helped cover higher costs of care, including marked up PPE and staff pay they had to nearly double. It's not clear how many COVID patients each facility housed or how often they got paid for empty beds. The state only revealed that a total of 4,047 people were cared for in an isolation center, which means each patient cost Florida taxpayers on average at least $12,600.
I'm not shocked by a number in that range just because long-term care is expensive.
Eric Carlson is an attorney for the advocacy group Justice for Aging. He says it's not the money that stands out, but the facilities that cashed in on the crisis.
The providers that sign up for programs like this are not the creme de la creme. We've seen that in multiple states.
Which perhaps explains why some of these nursing homes that received the most money in reimbursements also had shoddy histories. Take Oakbridge Healthcare Center in Lakeland and Countryside Rehab on Florida's West Coast. Both had histories of problems ranging from care issues to a lack of COVID infection control. They were also on Florida's nursing home watch list when the state added them to its map of COVID isolation centers. Records show in return, each received well over $4 million. Their parent company didn't respond to our request for comment.
You have the right to expect really professional levels of care from the people who are accepting the money and providing the care.
Recent inspection records also reveal some of these former COVID isolation centers are still being flagged for serious problems, including Dolphin Point, which in March was cited by state inspectors for supervision and staff competency issues that placed residents in, quote, immediate jeopardy. Those issues later corrected, records show.
It just goes to show that this industry still continues to fight with problems. staffing issues, deficiencies, fines continue even after these specific designations.
The state has no current plans to bring back isolation centers. If these facilities would do it again, I'm not sure, Dolphin Point's management owner told us. I believe this was a good use of taxpayer dollars, and I believed it helped save a lot of lives.
We've included more on what we know and what we don't know about reimbursements to these facilities. Check it out on our website. Katie LaGrone, ABC 27.